Hello, and welcome to Reimagining Mental Health in the Workplace, a program that we are producing together with Loyola University Chicago. I am Stephen Collins, the CEO of Matter. Our mission is to accelerate the pace of change of healthcare, and we do several things to support our objective. We run an incubator for healthcare startups. We have supported more than 1,000 companies from around the world that have gone on to raise more than $5 billion to fuel their growth. We also work with large enterprises to help them build their innovation capabilities with a suite of education, training, and insight services that help established organizations make sense of emerging technologies and figure out the best ways to harness them. We also run 6 to 8 accelerators per year, each one in partnership with health systems, life sciences companies, payers, associations, universities, where we work intensively for a few months with a cohort of startups that are all focused on a particular challenge. We are currently running several, including one focused on oral health, one on family caregiving, 2 on health equity, and one, most relevantly, on the mental health of young professionals in partnership with Loyola University. Much has been documented about the mental health challenges of teens and college students, but the well-being of young professionals has been less widely studied. A recent survey found that more than half of young professionals reported needing help for emotional or mental health problems within the past year. 43% screened positive for anxiety, 31% screened positive for depression. During today's event, we will hear from a panel focused on how we might better support mental health equity in the workplace for emerging professionals. We will then hear from Loyola's Merle Thomas about the accelerator that Matter and Loyola are running and how you could get involved, either by submitting an application or by attending the showcase in November. If at any point during the program you have questions for our panelists, please submit them in the Q&A section of the Zoom, and our moderator will weave them into the conversation as appropriate. And speaking of moderators, I am pleased to introduce Elaine Morrato, the founding dean of the Parkinson School of Health Sciences and Public Health at Loyola University Chicago. Dr. Morrato spent 14 years at Procter & Gamble before returning to school for her doctorate, and she was a professor and administrator at University of Colorado's School of Public Health. She is a visiting scientist at the FDA, and she brings a unique combination of scientific and business acumen, as well as academic rigor, to her role building and leading the Parkinson School. We have enjoyed getting to know her and work with her and her team, and I look forward to the conversation that she will lead today with this terrific panel. And with that, Elaine, I will turn it over to you.
Yeah, thank you very much, Stephen. We're very excited today in this health equity quest, to be elevating up the issues and challenges of mental health, particularly mental health of young professionals. As Stephen said, I have the honor of being the founding dean for the Parkinson School of Health Sciences and Public Health. Our North Star and mission is grounded in the World Health Organization's charter that access to good health is a fundamental human right. As a Jesuit university, we are called to be working for and with others on that quest together, embracing what we might call cura personalis, or care for the whole person, your physical, mental, and spiritual life, and really recognizing that if we are to address issues of health disparities on a quest for better health equity, we know it involves political, economic, and commercial, as well as social determinants of health. And so what we're hoping in these annual quests that we do is that we elevate up the topic. We work collaboratively with Matter to think of new ways to spur on solutions to these complex problems. So Stephen got us started with why mental health is important and why young professionals. But I wanted to just add a bit before we introduce our panelists as to the public health, or the health significance of it. If you look at Dr. Vivek Murthy's, our U.S. Surgeon General report last year, we recognize that we have a national epidemic of loneliness. And why is this important? Well, the mortality impact of being socially disconnected is estimated to be on the same level of magnitude as smoking 16 cigarettes a day. And we've been working tirelessly in public health to address, smoking cessation and tobacco use. And so we should be working just as tirelessly addressing mental health as well. It's been accelerated because of the pandemic and isolation. We're in a much more digital world, working remotely. And as Stephen said, our young people transitioning to new professional lives are a particularly vulnerable group, emerging from university into workforce. So with that, I invite my panelists to join me. And what we hope today is that we are connecting different parts of communities of practice that are very focused on these very problems, and that we have almost 200 folks registered to learn and hear about this. I think that's a reflection of the recognition and importance of the topic, and why we're interested in spurring this on. So I thought it would be good that we go round robin and folks can introduce themselves, and maybe as an icebreaker, tell us a little bit why your background, but also what was it like in your first job or internship? And what were some of the mental health challenges that you were facing? And how might that inspire how you're thinking about this problem today? I'll start with the top left of my screen with Christian Amador.
Well, hello, everyone. Thank you for having me here today. It's a pleasure and honor to be here. Christian Amador. I'm the Assistant Vice President of Strategic Initiatives for the newly established School of Global Health at Meharry Medical College. Thank you, Dean Morrato, for this question, this mental exercise in accessing our long-term memory banks, because for some of us, it's been a while since we've landed that first job. But I think, I bring up the time component because I wanted to mention how we are living in a different time, a different era. And, Dean Morrato, you kind of hinted at this, is where we're finally talking about mental health more. Back when I was in school and finishing school, the topic of mental health was never one that was ever addressed. Talking about mental health really had a stigma tied to it, which is a little different than today. We are more open about it. I mean, case in point, we're having summits that are dedicated to this, entrepreneurship dedicated to mental health. So that's amazing, right? When we did talk about mental health, it was more related to physical disorders of the brain rather than the overall well-being component of the self. So, with that in mind, I think I was part of that generation where we had that prevailing sentiment of suck it up and deal with it, which of course is not at all good, right? Not at all healthy. So just having the ability to talk about mental health and realizing that it's not taboo is one of the things that I think everybody should walk away with. There's a reassurance in knowing that all of us are going to have an off day at one point in our lives, trying to balance it all, especially for those of us who are young professionals who are coming out of college and you're transitioning from that different schedule to now being in a 9 to 5 Monday through Friday. And you're juggling multiple projects at work, and then you have bills, and then your personal life. So AKA you're adulting, right? And it's normal for us to have this experience. So I want everybody to realize that it's really a communal experience. We're all a community in this because we all are going to have some sort of an off moment. And that doesn't necessarily equate to you going off of the ledge, right? So let's normalize that sentiment, have these conversations with people around you, the ones that you trust the most. I think that if I could have taken that away when I first graduated, that really would have been a real win for me. And just saying, hey, I need a moment for myself, take a pause in life and adulting to be able to get your mental state of well-being back. That's really important.
Yeah, I think you emphasized some really things that resonated with me. We're in a time where we have a common language. We can use that language to understand. We're recognizing that feelings and emotions are natural human processes.
Right.
And we're shifting from medicalizing it to more of a public health prevention. So we really are at a unique moment in time. Deneen Pillar Jackson, welcome.
Good afternoon. Thank you. Good afternoon, everyone. Again, thank you so much. I am so honored to be on this panel for this very important discussion. And Christian, yes, I love everything that you discussed about in this day and time, us understanding and changing our language around mental health, that onion that we have, and understand that self-regulation is important and learning skills to do that, as well as co-regulation, how we work within our society. So my name is Deneen Pilar-Jackson. I am the founder and chief wellness and resiliency strategist at Teach One Wellness. I work with employers of all kinds as we look at this new workplace of the future that's intergenerational, that's neurodiverse, that is differently abled, so that we can approach this in a trauma-informed lens by incorporating the heart and the brain science behind principles, along with somatic principles to empower leaders, people managers, and their teams to thrive in this society. And so my first job after college was actually on the Chicago Board of Options Exchange. So I was on the floor. I was excited. It was a great job. I was excited about what I was learning. Options at the time was a very new security, but it was also stressful. I was young. It's a stressful environment, learning those complex skills, but also on my team, I was the only woman and I was the only woman of color. And so for me, I was anxious, I was nervous, I had a lot of self-doubt. And so one practice that I've learned that has been invaluable is the power of my breath. So using things that I had internally to control my anxiety. And there's nothing more valuable that we have that's readily accessible is our breathing practices. And so that's one thing that I wish I knew then that I learned along my career.
Yeah, really, there's so much more learning today around the biology of how we regulate, just as you said, you know, the power of the breath, the parasympathetic response.
That's right.
All of those good things, tips that we wish we knew when we were younger. Whitney Holmes, welcome. I'll give you the baton to you.
Thank you. Thank you. Good afternoon, everyone. Christian, Deneen, you guys both made such great points. My name is Whitney Holmes. I entered the workforce, full-time workforce, just last year, so very new for me. In the summer, I currently work for CVS Health on the Aetna side of things as a healthcare consultant in the Medicaid growth and strategy team. So my job is really connecting resources to our company, really working with those vulnerable populations that are impacted by Medicaid and bringing the best benefits and making sure access to care is, we're able to meet our members, our customers, et cetera, where they are. But when I think of this panel, I'm very excited to engage in this discussion, to bring the young professional perspective, especially as well. It's really exciting, I think, being a part of a generation who really values this in the workplace. I know when I graduated from grad school just last May, I was looking at organizations who not only value the populations they serve, but they value their employees, their colleagues, the people who work for them. So really excited to engage in this conversation. I think that's so important and also makes those more productive in the workplace as well. If you feel safe, if you feel that your wellness, both mentally and physically, is being valued, you naturally can be way more productive, and which benefits the organization. So really excited to be here, and thank you for the opportunity.
Yeah. So Whitney, let's start with you first. You know, you're our young professional. What do you see are some of the unique challenges that recent graduates are facing as they're transitioning from a university school life to a work life, professional life?
Absolutely. I think Christian hit on this earlier. The number one would probably be structure, or trying to regulate yourself to be structured, coming from late nights, studying, kind of doing homework whenever you felt like it or whenever you're able to, classes kind of scattered all over the week, is now being on 9 to 5. In my case, it's more like 8 to 6, and being engaged in all those meetings during the day, but still carving out time to actually do your work after all those meetings all day long. So I think that is a big one. I think that also is peer pressure to perform. As a new careerist, a young careerist, you come into this company, there's people on your team, those you work with who have been working for CVS, I know in my case, for 20 years, 25 years, et cetera, who have a lot of knowledge and a lot of experience. So being able to perform and prove your worth, so to speak, when you come in as an early careerist and that pressure, but also bringing your perspective and making sure you feel valued in that, position that you're in. I think another thing is work-life balance. I know our generation really values that, and we talk about it a lot, especially on social media and those, but really putting it into action, I think is a really tough thing. Making sure that since you're on back-to-back meetings, maybe that you do get up, you walk around, you drink your water, you take a break to eat lunch. I know I'm really bad about that. Is I look up and I'm like, oh, I need to eat something. So I think those are the really most significant things for young professionals. But the last thing would be outside of the office, so to speak, itself. But if you have to relocate, I relocated to Chicago for my first role, and I'm from Atlanta. Big difference, very far from home. So that also increases the pressure and can have an impact on your mental well-being as well in the workplace.
Yeah, and also the definition of what is a workplace is sort of changing underneath us as well. Is it a physical
Yes.
place? Is it a virtual place? Is it a mix somewhere in between? So I'm wondering, Deneen, listening to Whitney, the pressure of performing, high expectations probably for yourself as well. How does that play out then in mental well-being for individuals?
Sure. So Whitney, thank you for sharing that information, and you're right on target. Let's look at, we talked about some of the statistics around stress and anxiety for young adults, but I'm going to talk about across the generation so that we can understand the amount of pressure that our millennials and our Generation Zs are experiencing in the workplace. So for baby boomers, so those are those who are 60 to 78 years old. For Generation X, for those who are 44 to 59 years old. The millennials, 28 to 43 years old. And then Generation Z, those could be 21 to 27-year-old for this conversation. So when we're thinking about stress, baby boomers, 38%, Generation X, 57%, millennials, 65%, and then Generation Z, 71%. So there are many reasons why this could be occurring. We mentioned that before we weren't so willing to talk about our mental health in the workplace, so that can impact some of our older generations. But certainly our young generations are inflicted with a lot of different pressures that they're experiencing. Everything from the high expectations, the job insecurities, the pressure to succeed, that all impacts their mental health with these escalated urgencies to address their mental health and how workplaces can adopt their practices to work with them. If you think about it, our young adults are experiencing more debt. So the pressure to succeed, to purchase those homes, to move out from their parents' house and to be able to succeed and even do better than their parents, our young adults are experiencing pressure there. In the workplace, the skill sets that are needed are changing and evolving so quickly. And then with social media, we know that with young adults, social media is one of the drivers for increase in anxiety and distress. And so there's competition. Those platforms that are good for professionalism, like LinkedIn, are also tied to anxiety that they experience on a constant basis because they're being compared. And so, again, it's important to have these conversations about how we can better support our young adults working in the workplace so that they can succeed as they integrate with the other generations.
Yeah, the pace of life, if I reflect back on when I was young, I could close my office, leave the computer there and go home. And now it's so digital life is so ever present too, as you're saying.
That's right.
So, Christian, you focus on equity, disparities, whether it be political, economic, or social. How does that factor in here in terms of when we think about variation among young people and how they're responding to these stressors?
Yeah, I think I'm going to echo a lot of the things that my co-panelists have already mentioned, but the one thing that really just comes to mind is stress. And Deneen just gave us some really good statistics about all of that, right? But when we think of ourselves, human beings, we are intersectional, right? We are not just one-sided. There's a lot of components that come to us. So we are really a symbol of complexity within ourselves, right? We have our lived experiences, we have our backgrounds, we have our educational experiences, and then the things that we experience throughout our life course, all of that, is a part of how we react, how we reflect, what we do, etc. So, in a nutshell, I'll try to answer this the best that I can, but, we talked about student debt, we can talk about socioeconomic status, all of these are different areas of study that have already been investigated. And so, each of them deserve their own like dedicated time of discussion, but I want to talk about how stress really goes a step further in affecting us both mentally and physiologically. The literature tells us that just based off of documented data and evidence, individuals who are considered from the lower socioeconomic background area may experience more stress from things like job insecurity, poverty, inadequate healthcare, right? And this stress can lead to the development of mental illness. Student debt, as Deneen just told us, is another stressor. There are several studies out there, that two of which that I want to highlight, but they both tell us that mental and physical effects are tied to finances, specifically student loan. In 2015, the University of South Carolina found that there are many negative health effects, including increased stress, feelings of depleted health that can stem from accumulating student loan debt. And then a Northwestern University study determined that this feeling of significant indebtedness raised people's blood pressures, their diastolic blood pressure. So this is a real symptom, a real physical manifestation. And as we know, increased blood pressure can lead to increased risk in hypertension and stroke, right? When we talk about access to resources, that, resources can be defined in many ways, but it can, simply the way I look at these resources, it's about being able to maintain a healthy state of well-being. Not having these resources denies you the opportunity to live your most optimal life. And that really is where health equity comes into play. And mental health equity is a piece of that. So when we think about access to care, specifically therapy when you need it, right? Or social support, or even the ability to manage our finances, as we just finished talking about, all of those things play into overall health equity. But unfortunately, for certain populations within the US, these outcomes are even worse, right? They're more dire due to some of the systemic and structural barriers that we've put in place throughout our history of this country. And these barriers are there because we've codified into law some of these discriminatory practices that still exist to this very day, unfortunately. The most notable is historic exclusion and racism against many ethnic and racial groups in the United States. We know that slavery against Blacks and African Americans was an example, genocide against indigenous and tribal populations, as well as immigrant populations, Asians, Latinos, Middle East, South Asians, etc. Depending on what point in history and time that you want to focus at, they've all been affected. That has all led to these disparate outcomes, but really have contributed to the health inequities that exist within these different populations.
Yeah, I know we talk a lot in health, public health, around intergenerational trauma, right? So even things that happen at your grandparents' level, how they then brought that to them and your parents, and how that carries forward, not just how we behave with one another, but even in how our DNA gets upregulated or downregulated to respond. It really, the more you start to learn, the more you realize how complex it is, for sure.
Yes.
So, Deneen, I'm wondering, some might counter argument. all of us are stressed. Why don't we just focus on general mental health solutions? We have many that have signed up for this webinar. They're coming from companies or startups. They're trying to figure out solutions. Why is it important that we consider the equity lens as part of that innovation generation?
Yeah, that's a great question. And the question around equity versus equality has been coming up in workplaces in a tremendous way lately also. But I like an analogy one of my mentors, Tyrone Studemeyer, uses, and he actually has a book that's new called Diversity Done Right. So he talks about a family of four, and they buy bikes for the four family members. For one of the children, they're not quite big enough, so they can't reach the pedals. For the mom, she is perfectly fine and comfortable riding her bike. It fits her. Then the dad, the bike's a little too small for him. His knees are too big and impacting the way that he pedals. And then they have one child who's in a wheelchair. And so they buy the bike for them. They're all the same bike. So it's equal because everyone got a bike, but how that bike fits them is what's important for them to be effective in having a family bike ride. And so to translate that into the workplace, let's say the child who couldn't quite reach the pedal is like a young adult coming into the workplace. They're new. There's some things that they need to learn, definitely in this environment as we've transitioned from some hybrid workplaces or totally working from home, understanding the social norms or the political environment or how the culture of that operation works. They may need additional assistance and training and mentors to make that happen. For the mom who could ride her bike perfectly, maybe that's a person who's been at the organization. And so when it comes to mental health resources, they may not need the specific or additional tools and resources available. Maybe regular check-ins with their manager would suffice. Then we have the father where, the pedals are too big. That could be an executive. And so what he needs to be a director and to facilitate within his team and to grow his team as a leader may be different. And then we have that child that's in the wheelchair. They need specific supports because of their situation to help them grow and succeed in their career. Maybe a career pathway could help. Additional advocates could help them. So when we talk about equity versus equality, everyone can get the same tools with regards to mental health care, but that doesn't mean you're fitting the specific needs of that person. And so I would say that's why when we're thinking about mental health and the types of care that an organization can provide and resources, being thoughtful about the individual is important so that it'll be used, it'll be effective, and as a result, make that person personally more successful, as well as the organization, the work that they're doing.
Yeah, I love the bicycle analogy. It really brings to like visualization. We talk about one size doesn't fit all and the need for tailoring. And yet we all operate, as you said, in a multi-generational workplace. And so that means we need to get the whole family on the bike ride together. We don't want to leave anyone at home, right? So it really means a lot. Whitney, you mentioned you're new in your professional life, and I know there's been some exciting things you've been sharing with us as we were preparing for our discussion today about CVS and Aetna, and maybe some community development programs that you see. Are there some examples that you can share with our audience here about companies who are leading the way in doing this?
Yes, absolutely. I can talk first about just general resources that our company offers to all colleagues. One that we just talked about, Christian touched on financial pressures and how that could add for stress. While we have entire teams dedicated to just serving as financial advisors as a resource to colleagues. So I've used it a couple of times. I think we have 10 sessions per quarter, something like that, where you can get advice on your debt, how to pay it down. I know my age is getting to the age where, okay, we are exploring, maybe I do want to buy a house in a couple of years. You could get advice on that. Also balancing credit card debt. Because when you're in school, no one teaches you about that. And when you come out, it's all of a sudden you have this. Things of that nature, which is really, really helpful, especially going into the workforce as a young professional. That's something that you want to get guidance on, and it's free, which is really nice. I think another resource is that I just learned about recently actually is Resources for Living. So this is helping families, those that might have children or spouses with chronic conditions, also with assistance with mental well-being in terms of a substance abuse disorder or some type of disorder or disease that might impact your day-to-day lives, but also just simply serving as a mental wellness and being resource as well. So you can get counseling sessions for 30 times a year, I believe, something like that. That's also free for colleagues. So those are a lot of general resources that are available to us. I think another thing to touch on that's important is fostering a culture that encourages you to take your PTO. Not only do we get a fair share of PTO, even as a young careerist, I think I was telling this to my dad yesterday. He was like, wow, when I started, I didn't get all of that paid time off. But also your leaders want you to take it. You know, please take your PTO. I didn't take a day off all year until recently, last month, and my manager was like, disconnect. We'll touch base when you get back. So respecting your boundaries as well when you are on vacation, but also encouraging you to take it. I think that's a really, really big thing for me. And that is productive in the workplace as well. Now, as far as community development programs, I am in an accelerated development program that's 3 years, and we have 3 different roles within that program. And with this, there's a lot of support that is built around these programs. There's 12 different ones across the enterprise in various areas such as marketing, general management, etc. And I think the company does a really good job in investing resources, both financially, other people in the workforce, making sure leadership's available to support the young professionals coming in who will one day be the leaders of the company. So one of those resources is having communities. So what this means is the various programs, they establish hubs in different large cities all across the country. So like I said, I was recently located in Chicago. So Chicago was a community. So you had about 50 to 60 early career individuals in those programs dedicated to the Chicago office. So with that, it helps when you relocate. I relocated, didn't know anyone in Chicago, but it helped because I had all these other peers who were in relatively the same place as life, but also in their careers to help with just simply finding what grocery store should I go to, things of that nature, but also with networking, because there were community events where you would get to meet with the leaders who are in those cities within those communities as well. So that was really helpful. I think another thing is having speakers come in. We have monthly, bi-monthly, all of these different meetings we can attend with various leaders who come, speak about their roles, speak about resources for you to use throughout the enterprise, things of that nature. So I think as a young professional, having that support and seeing how the company values young professionals, those who are the future of the company, and investing in those resources is really important as well.
Yeah. Sounds like there's some exciting things at your location,
Yes.
which is a large employer that cares about health. So you're in a place that's putting their money where their mouth is, so to speak. I'm wondering, Christian, not everyone is a large employer. Not everyone is health focused. Why is it important for employers to ensure mental health equity for all at their work sites? What have you learned? I know you've done some interesting work with Deloitte.
Yeah, first of all, I love to hear what Whitney mentioned. I think those are definitely great examples as employers, right? Again, being that we are in a different time, a different era, as a society, we have evolved. And I think we're starting to realize that health in general is not just your genetics, it's not just your personal choices. We've come to understand that there are other external forces that are at play. A few of which that I've mentioned to you earlier today. These are commonly called these social determinants of health. And the more upstream ones that I personally work on at the school are the political determinants of health. And these are determinants that have led to the creation of some of the social determinants through voting, through government, through policy that, I mentioned earlier, get codified into law. And that's how they become a part of our society. That being said, these external forces cannot be combated within the walls of a clinic or a hospital. It really falls on a collaborative, a whole of society approach and effort. And in this case, the private sector, companies, no matter the size, also need to take some accountability and responsibility for some of the things that we've observed, some of the stats that Whitney mentioned earlier, and Deneen. In a recently published report that we did here at the school, we projected the costs and the economic impact of mental health inequities in the US. And we found that productivity loss in the workplace is being deeply impacted by mental health because it's directly affecting the workforce. And Whitney had mentioned this earlier on. But in the report, mental health inequities can result in productivity losses when workers take more sick days, what we call absenteeism, or when they show up to work but are not fully functioning, that's called presenteeism, or when they become unemployed due to mental health issues, right? That's just unemployment. So just to give you some numbers, the projected cost that we observed today due to mental health conditions amounted to $116 billion. It's a lot, right? We took this a step further, and then we projected this cost 10 years from now. Keeping the current trend constant, we found that by 2040, the cost will amount to a jaw-dropping number of $252.3 billion. It's a lot, right? It's a number that most of us can't even fathom. So if nothing else is important, these numbers tell us that it behooves employers to have a healthy workforce of sound body and mind, because it does impact their bottom line, as well as the country's GDP. And also because it affects, as Whitney was talking about, the work culture, whatever the company's mission and values are set out to be. All of that is directly tied into this. There's a quote whenever we're working on mental health that I always want to bring up because I think it's so deep and meaningful. And it comes from Dr. David Satcher, who served as our 16th US Surgeon General. He was the first Surgeon General to ever publish a report that focused on mental health at that level of government. And he stated, there can be no health without mental health. And if we truly understand this statement, then we know what we must do, especially in the workplace, right? It translates to doing things that minimize bias, that enhance fair practices, that create this work culture that is inviting of all backgrounds. And lastly, and probably the most tangible, is ensuring that workers have adequate health benefits. Somebody in the chat brought this up, but specifically mental health benefits, because although we have parity rules and laws, mental health benefits still aren't at the same level as health benefits.
Yeah. All of us, I think, need to be as prepped as you all are in making the business case for mental health in the workplace, right? It's very easy to say this is an individual problem, it's about individual cost, but the numbers show how that scales at society, the economic cost, and because we're working with an incubator, the business case, right, for why we need to do this. I know also that, okay, you've sold me on the business case. I'm now, what did you have it, Deneen, generation? I'm a Generation X. I'm a manager. I might be, what do they call it? Geriatric millennial, an older millennial. And I now have someone I'm supervising who's in their 20s. And maybe I didn't get socialized or role modeled on how to deal with mental health or stress in the workplace myself. I don't really know how to go about supporting those that work for me. So Deneen, what advice do you have to better support managers, or how we adapt our hiring processes or our onboarding processes so that we are supporting the resiliency of our workforce?
Absolutely. These are all skills, right? So on this panel, especially Christian, and certainly you, Dr. Morrato, Dina Morrato, you may know this because this is your profession and you've done a lot of research and self-study and action with yourself. But in general, understanding your brain, understanding the heart science are all skills that we need to learn. And so the number one thing I would advocate within workplaces is that training at all levels for your managers. First, the managers will become more empowered themselves. They will practice these skills themselves to understand how they work. And then that will enable them even better to adapt them into their workplace with their employees. I know one of the most valuable things that I learned as I talk about the brain science is a book by Dr. Bruce Perry. It's called What Happened to You. And in the book, we talk about when you're dysregulated, either low energy type of emotions or those type of emotions that are dealing with high energy, anxiety, and stress, that your brain, your IQ can be cut in half. And so just knowing that, being more empowered with yourself to be more kind and compassionate with yourself, being more mindful of your emotions and how you're feeling, and figuring out those resiliency tools that you can use to get yourself back into your focused brain. When you learn these skills, when you apply these skills, it helps you to see what we're talking about. Instead of seeing a behavior and saying, why did they do that? We're really asking the question, what's happening with them that this behavior is coming up in our space? And so when we think about preparing the workforce, the number one thing I would say is employers investing and the time and dollars into training their managers at all levels. And I would say to that, you'll see change in the workplace occur before you'll see the actual statistics and the ratios change with what the metrics you should be looking at to evaluate this work. And sometimes that can be discouraging for employers because, you know, they want to see an economic impact effect early. But these are things that take time to adopt different practices and for them to show up in your culture. And so investing in the training, allowing space and time for them to take effect, I would encourage employers to think about.
Yeah, and recognizing that, as we like to say, there's a biological basis for the practicing of the skills and learning new habits, rewiring how we respond to like stimuli and such.
That's right.
And that not to get discouraged if, you know, we're practicing new things that maybe we weren't taught when we were little and we're having to change behaviors or habits, right? The one I try to remind for myself is curiosity. You know, listen with curiosity versus, you know, and openness. But, you know, that, yeah, as you say, it takes awareness, skill building. So before I give a round robin for each of our panelists to say, you know, what advice do they have for innovators on here, I thought we'd have one more question with you, Whitney. What are some, you know, as you talk amongst your peers, you know, we're really focusing our health equity quest on folks just like you, young professionals. What are you hearing are tips or tricks or things that you're hearing are on the minds of young professionals that we haven't mentioned already, that you think is important that we do mention?
Yes, absolutely. I think one thing is identifying gaps, I would say, in each generation. I think a big one with us is obviously COVID. I graduated in peak COVID time from college, and then many others I work with are in that program I mentioned are also graduated within COVID. So I think working and understanding, you know, what was missing during those years. Obviously, we were virtual, but even as, you know, going back to job interviewing, you know, when I was an undergraduate, earlier in undergraduate, I did learn how to come into a room, how to dress, you know, how to shake someone's hand when you're interviewing. But a lot of students who graduated with COVID did not, because you were on Teams or Zoom or whatever. So I think that's a big one to understand, but also understanding kind of what each generation values. I think knowing that we can foster relationships virtually, I think it's important to note. Because that's what we've known for most of our lives, you know? So understanding the value in that though, but also creating opportunities to get the in-person environment. I think that's a big one. I think also another one I would say is understanding um, that the younger generations, we might not always voice what we need help with, and providing that safe space to do so. I think that's a big one, that sometimes we have that social anxiety, even that because we're so used to being virtual, even though we do talk so much on social media, but understanding that we might need help, that we're trying to find solutions without directly going to your manager because you don't want to burden them with that, but understanding and providing that space where it's okay to ask questions. It is okay to go directly to your manager if you do need assistance with something. I think that's a big one. I've had many questions about that from my peers. They will come to me with an Excel document and we will brainstorm and brainstorm and brainstorm. And then I'm like, okay, just ask your manager at this point because it needs to get done. But there's a lot of people who are genuinely sometimes afraid to do that. So understanding that as well and why that could be productive and helpful is, I think, is an important thing to mention.
Yeah, as you're saying that, I was reflecting back on what you were saying earlier as well, Deneen, about the multiple generations. I'm older and we were socialized to just walk down the hallway, knock on the door, management by walking around, pick up the phone and just talk to people. And what I'm seeing as I work with young people is I text you. I don't go to the door to ring the doorbell. I text you I'm here, right? So the form of communication is just very different. And there's not like one's right and one's wrong, but it does, I guess it starts with that awareness that we are all socialized different. It's not like one is good or bad. But to be aware is probably what's most important. So we have innovators on. We at Loyola University Chicago are sponsoring an incubator with Matter. So you all are experts. What advice would you have for the inventors out there listening around what they should think about as part of their problem solution fit? Anyone can go. Christian, you want to go first?
Sure. I think I've hinted at this before already, but to really bring the message home, I would urge all of you innovators to harness the power of collaboration. Sometimes we want to invent things from scratch, which there's nothing wrong with that. And we've seen that in medicine, we've seen that in public health. And alone, you can only get so far. But when you come together, you can achieve so much more. And especially when we build on what is already existing, the current knowledge, the current scientific body of existing information, and that helps us to target certain areas and increase the breadth and the scope of what we already have, right? And when we talk about mental health equity and health equity in general, really it lies in working within community, putting community at the center of these initiatives, what we call in public health community-centered, community-first approaches. So my hope is that all of you come up with great things that challenge the status quo and help to catapult that health equity needle forward.
You remind me of something I was taught early on when I was at Procter & Gamble. As a global organization, search and reapply, like search for others that may be already working on this, and not just in the US, outside the US.
Absolutely.
And oftentimes there's a lot of innovation that are in other geographies and other settings that we can work together. So I think your call is really, really vital. Whitney, what advice do you have for our inventors out there?
Yeah, I would build upon a little bit what Christian said, not only building the resources, making community, not reinventing the wheel, but making it easily digestible and accessible to people as well. I think I work in health insurance. I think a big thing we encounter with our members is they don't know what they have available to them and they don't understand it either. So making it, where people actually understand not only what resources are available to them, but what it means. How many counseling sessions do they have access to? What does that mean, a counseling session? Am I with a therapist? I'm with a counselor, when it comes to medications, what medications are really covered that could help me stay focused every day from in my workplace. So I think that's another thing. If you could make it easily digestible, easily accessible on top of providing the resources in the beginning, that would be really helpful.
Yeah, meet people where they are and their level of understanding where they are.
Exactly.
Yeah, Deneen, what advice would you give?
That's fantastic, Christian and Whitney, with your advice. So I think the only thing that's left that I have to share is really tapping the voice of the customers that you're going to serve. Sometimes we're answering a question that wasn't asked. So making sure the solutions that you're coming up with are really needed by the audience that you're looking to serve. And one small thing to just get out there and try. Encourage organizations to learning occurs in small spurts. You don't move in dynamic ways, you move in small ways. So making things small, digestible, where they can be consistent. I would encourage that as well.
Yeah, yeah, and iterate, and iterating is good. Well, I just want to say thank you very much, Christian, Deneen, and Whitney, for your time today, for sharing your own personal experience and your wisdom on the topic. We hope that by having a forum like this, that it's spurring on insights that will support our health equity quest this year that Loyola Chicago is sponsoring with Matter. It is focused on this important problem of mental health, particularly for young professionals. So I would like to introduce a colleague of mine from Loyola, Chicago, Merle Thomas, who's going to just share a little bit more about what the quest is and how you might get involved if you are inspired. So I'll hand it over to you, Merle, and thank you everyone for your time and attention.
Thank you so much to Dean Morrato and our amazing panel of speakers for sharing your unique insights with us this afternoon. I'm Merle Thomas with Loyola's Parkinson School, and we are super excited to partner again with Matter this year to address this issue of mental health. As you heard this afternoon, it's a concern that's growing across the country, across different industries, and its impact is really pivotal within today's multi-generational workforce. So as such, we invite solutions to address the challenge statement that is laid out before you on the screen. How might we better support mental health equity in the workplace? So we have two tracks that you can apply to. The first, mental health support for students transitioning to the workplace. And we had some great examples that were provided by our panel earlier, as well as mental health support for early career professionals. So who can apply? We are encouraging innovative solutions from global innovators, university students, and existing startups. And there are some amazing benefits to participation. So you are welcome to become part of a community of forward-looking solutions and companies. In addition to that, you are going to be learning from carefully selected peers, partners, and mentors. That is a mix of our Loyola and Matter ecosystems. Up to 3 organizations will receive a 6-month Matter Global membership. And last but not least, there is a prize bucket of up to $35,000 that will be divided by the final 3 winning solutions. So we also have our timeline that is laid out here before us. We have opened the application portal just a few weeks ago on August the 7th, and the portal will remain open until September the 27th. We will move on from there to select 10 winning solutions as finalists, and followed from there, we'll have a what we call a sprint season, October 21st through November the 8th, of roughly about 3 weeks of time, where these 10 solutions will meet with Loyola, Chicago, and Matter teams to really kind of refine that value proposition and prep for the big day, which is our live pitch event. So that will wrap up on November the 14th, where you will be pitching live at the Matter incubator or virtually to the public. And we invite amazing solutions to participate with us for that day. And if you do have questions, and I certainly do hope that today's conversation has piqued your interest in applying, please take a few minutes to go to our website, luc.edu/quest. Take a look at the details of this innovation challenge. And then also there is an email address that you can contact with any questions, Samantha@matter.health. And we thank you for joining us this afternoon.
Thank you very much, Merle, for that information. I know in the chat is ways that individuals can decide to also register if they want to listen in on the pitches or learn more about the items that Merle mentioned right now. The links are there live. And I just want to close this out and say thank you for everyone who has joined us on this very important health topic today. Have a good one. Bye-bye.